Hey there, viewers! Are you constantly worried about diseases? There are so many illnesses they tell you to worry about nowadays, you're bound to start panicking. Out of all the illnesses there are, kidney disease is by far one of the worst. 1 in 3 US adults is said to be at risk of it. Let's talk today about early warning signs of kidney disease. Are you feeling tired? Are you running to the bathroom all the time? Is your skin always dry and itchy? We're talking about all those and more. Your skin feels dry and itchy. If you didn't already know, kidneys play not 1 or 2, but many important roles in our body. From creating red blood cells to removing extra fluid and waste, kidneys do it all. One of the more important jobs of kidneys is to maintain the right balance of nutrients and minerals in our blood. When our kidneys are not performing well, it results in an imbalance of these minerals and nutrients. This is called mineral and bone disorder. This lack of minerals will show on the outside of your body. Your skin will begin looking really dry. In extreme cases, you may look like you've aged. So when your skin starts feeling a little too itchy, don't ignore it. Your kidneys are probably not getting the right nutrition. Go see a doctor as soon as you can. You're lacking energy. We all feel a bit lazy from time to time. You know the feeling. You're so drained, you don't even have the motivation to go to work. You just want to stay in and watch Netflix. The problem is when you're feeling this way all the time. If this is the case, you're probably experiencing health problems. Kidney disease is one of the big possibilities. If your kidneys haven't been functioning, there can be a buildup of toxins in your blood. When this happens, you start feeling more tired than usual. You feel like you have no energy and you're constantly weak. You may even find it hard to concentrate in this situation. Anemia is a complication of kidney disorder, which results in fatigue. These symptoms will be pretty obvious as they get in the way of your day-to-day tasks. It goes without saying that it gets harder for you to live your normal life, as these symptoms will have you lying in bed and feeling sick all day. So, as you start to feel completely drained of energy and concentration, get to the doctor immediately. Your urine looks foamy. This is one of those signs that can be confusing for most. I mean, isn't all urine kind of foamy? If you've been passing foamy urine recently, you might be going through what we call the early signs of kidney disease. When we say foamy, we're talking about a lot of big bubbles. You might find yourself flushing more than necessary to get your toilet clean of your foamy urine. It's important to describe foamy urine because everyone will see some sort of bubbles in the toilet after they've just gone to pee. This symptom might seem normal at first, but it's a big warning sign of kidney disease. Your urine gets foamy because there's a lot of protein in it. It's your kidney's job to filter out the waste and keep all the nutrients. The presence of protein in your urine means that your kidneys are not working properly. A lot of protein will indicate a serious kidney disorder. When people suffer from kidney disease, foamy urine happens on the regular. You are having issues sleeping and also frequent nightmares. Insomnia is one of the more common problems adults deal with. People sometimes have trouble getting to sleep for weeks on end. When you finally do get to sleep, your dreams are filled with terror. After a while, you won't want to get any sleep. If this is something you've been experiencing, it's because there are toxins present in your blood. Like we mentioned several times, one of the top functions of your kidneys is to clear out impurities and toxins from your blood so that they can be passed through your urine. But if you have a kidney disorder, it simply means your kidneys are not doing such a great job clearing out your blood. This is the reason behind all those sleepless nights, as well as the nightmares you have when you do sleep. It also needs to be mentioned that nightmares are not experienced by all patients of kidney disorder. So even if you're just having issues sleeping, you may still have a kidney disorder. You have blood in your urine. If you see blood in your urine, you know right away that something is wrong. Blood in urine is not common and can be pretty traumatic upon discovery. In patients suffering from kidney disease, blood in urine is amongst the most common symptoms. While a healthy pair of kidneys do their job filtering waste and impurity from the blood, the red blood cells are supposed to stay inside your system. If your kidneys are not healthy, it's possible that your red blood cells are mixed with your urine, resulting in the red liquid you see in the toilet. Blood and urine can also indicate kidney stones, tumors, and even an infection. You have a loss of appetite. If you've had less of an urge to eat lately, this could be an early sign of kidney disease. Loss of appetite during kidney disease happens when compounds start to build up in your blood. The process of waste building up in your blood is called uremia. It not only impacts your hunger, but also has a negative impact on your sense of taste. In this situation, even your favorite food starts tasting like metal to you. That slice of pizza you have for lunch on Friday, you won't want it as much. Since you're not eating the way you used to, you're gonna lose a lot of weight. If you find that your appetite has suddenly changed, it's best to talk to your doctor ASAP. With less food going into your system, you won't be getting the amount of nutrients you need. You're going to the bathroom all the time. Never mind blood in the urine, if you've been having frequent urges to pee lately, you might be at a high risk of kidney disease. Now, keep in mind that frequent urges to urinate can be linked to other health conditions as well. This could indicate an enlarged prostate and urinary tract infection. It's important to note that in the case of kidney disease, this constant urge to urinate usually happens at nighttime. When your kidneys are unhealthy, the filters are damaged. This causes you to pee prematurely. If you're feeling the symptom, don't wait too long to get a checkup. You have swollen feet and ankles. Have you ever taken your socks off to find that your feet have doubled in size? You almost feel like you need a new set of shoes. If your feet and ankles have blown up, don't let it go unnoticed. As we get older, we often mistake things like this as just another sign of aging. In reality, we don't realize that our kidneys might be in trouble. If you're over the age of 30, you should try and pay more attention to your body. It could be sending you messages. Swollen feet and ankles are one of the main signs that your kidneys are failing. This needs to be treated right away. This happens when there is sodium retention in your body, relating to decreased kidney function. It needs to be made clear that swollen feet and ankles can also be a symptom of liver disease, heart disease, and even vein problems in your legs. Your muscles are cramped. Sore muscles are fairly common. A lot of us get them just from having a rough workout. If you have muscle cramps, you might feel the urge to apply some ointment over it, or even pop a painkiller. But if they've been continuing for a while now, don't just pass it off as some normal thing. This could be a sign of kidney disease. It happens when there's an electrolyte imbalance in your body due to impaired kidney function. When the electrolyte imbalance happens, your body will go through things like poorly controlled phosphorus and low calcium levels. These directly lead to your aching muscles. If your sore muscles have lasted longer than a couple of weeks, book your appointment with a physician and get them checked out. Your eyes have been really puffy lately. Whoa, dude, what's wrong with your eyes? Were you stung by a bee or something? If you've been walking around with puffy eyes and haven't noticed, you'll know it soon enough. Chances are you'll be getting some comments thrown your way. Whether you know it or not, puffy eyes are nothing to joke about. Persistent puffy eyes are a common symptom when it comes to kidney disease. You'll notice that the outer area of your eyes is swollen. This is related to the foamy urine we talked about earlier. When your kidneys are failing to keep protein inside your body, it gets out with your urine, causing the urine to be all foamy. As a result, there is a shortage of protein, which causes your eyes to puff up. These symptoms need to be taken seriously, as chronic kidney disease is the 16th highest cause of death in the world. Kidney disease can be a lot to deal with, but if it's treated within the proper amount of time, you should be fine. Let's keep the conversation going with a couple kidney-related videos, shall we? Here's what you need to know. Watch 9 foods that will help your kidneys function. Or how about 5 ways to stop painful kidney stones? Go ahead, click one, or better yet, watch both and learn more about how to make your kidneys healthier. Have you been experiencing any of these symptoms? Let us know in the comments below.